Okay, we're live, so we'll go ahead and call the meeting. Sorry, I'm running a few minutes late. It's 3:11. The first item is to review the March minutes, and we'll need an approval for those. Make that motion. Thank you. Okay, the next item on the agenda is under old business. This is just the update that we've been doing since we started the correctional program checklist. Each time I meet with the state, we set new goals and action plans. And so we're continuing to work on those action plans and create new ones. I have an appointment scheduled with him on July 30th to review what we've done since our last meeting and get caught up, and then set the new goals for the next quarter. So we're meeting with him quarterly to make sure that we keep progressing in our goals and completing our action plans. So that's all going really well. The last time I met with him, I got positive feedback stating that we were continuing to make progress, and he could tell that we were working on our action plans as me individually and then as an office as a whole as well. So that was good positive feedback we got from him. Anybody have any questions on that? Okay. The next item under new business is just to review the grants. The 25 grant audit documents have all been submitted. That was the same as it was the last time we had a meeting. We're still waiting on the final audit reports. They have not asked me for any additional documents or anything. So, I mean, that's typically I have everything good and ready for them. And they just, whenever they're finished, they'll send me their findings. So nothing new to report on that. All good on that. The current grants, everything's going fine. We're on track as planned for 26. So I have nothing new to report on the current grants. Does anybody have any questions on those? Okay. So the real business is the 27 grants. So I'm going to kind of combine the 27 grants with, and then underneath it says drug court. So we're going to talk about them together. The community corrections grant award was the same as it was last year. So we didn't get an increase, but we didn't get decreased either. So that's a good thing. So that stayed the same. So you will see in your budget for the 27 community corrections part, the salaries have been adjusted to what they will be for 27. And then everything else is out of project income. So you can see we're taking still a big chunk out of project income for all of our operational costs, all of the benefits, fringe, Social Security, all of that all comes out of project income. So as you can see, if you're looking at the budget, there's a lot that comes out for that. Now the budget that we have, so if you're looking at the top, that's just the salary part. The grants paid for most of the salaries, but then the project income has all of the benefits. Then if you look at the second section where it says budget summary, you'll see the series 2, 3, 400. Those are the budgets that we set. It doesn't mean that that's it. We never spend that much in there. We just set them as like, as you can, if you look through, like $3,000 office supplies. So it doesn't mean that's what we're going to spend. That's just what we've budgeted for the year. And with that, we don't have to spend that like amount. That's our money. So just to make sure that there is a difference, like the grant money, if we don't spend it, we have to send it back. But the project income is our user fees. So what people pay to be on our programs. And so that is just our estimated budget for 27. Does anybody have any questions on the community corrections budget? There are no questions. I'll need an approval for that budget.
Make a motion to approve.
I have a question.
Okay.
Wait, sorry. So, with what's the drug court grant, that's now included in 27 grants.
So it is not. So that's why I had to do, the first one I sent, I put them all together. They said to go ahead and put them all together. And then he changed his mind and said, no, we still need that because you submitted the drug court grant. We still need a budget for that. So what happened, so we'll skip down to the drug court grant real
Sorry,
quick.
That's, why
That's okay. The drug court grant was not funded at all. So it was completely defunded, which included a case manager's salary, benefits, and a field officer. So that all of that next year is going to have to come out of our project income. So if you're looking at the drug court budget, you'll see that under the grants, there's 0. And then under project income is now the new amounts. And this one is what it is. That amount is going to come out of our project income.
But you can't reflect that in this one.
I cannot reflect it in the community corrections grant because that was submitted as they are, and it's kind of confusing because they are one project income. So basically we're adding those two together
Okay.
when I do my budget. But for this, they had to be separated.
And are we just including you guys in, Tracy was talking, and she called Indianapolis, and Indianapolis said that the Chief Justice was looking into it, and the Office of Court Administration was looking into it. And basically, counties, as of last week, were awaiting guidance.
So
Haven't heard any more.
I reached back out on Monday to Angie with the Indiana Office of Court Services.
Okay.
Last week, they had a meeting with the Chief Justice to discuss possibly helping out the counties. We're not the only county. I would make sure that we're not the only county that was completely defunded or had received a major cut. As I was talking to you guys back when we were submitting the grants and approving those, community corrections, the grants as a whole, all of the programs that are funded by community corrections, by this Department of Corrections grant, 11.2 million was cut for 27. So a lot of people did get cut. The Indiana Office of Court Services knew that. They had a meeting with the Chief Justice to see if there was any help that they could do to help with, especially the court programs that like drug courts and some probations get some of this money, and some different court programs, jail programs get funding through this. She replied back to me yesterday or Monday, and she said that they have not confirmed any information. It is being discussed, but they are not sure if they will be able to help or not yet. That's the reply I got back from her.
Did they give any indication, and I don't, on why our program was entirely cut?
Yeah, so I know Samantha asked that. No. There's a whole list of things that they look for. One is the number of people that we serve, and I'm afraid that may have been a big part of it, because, we serve 10, 15 people a year, sometimes less,
And what's our capacity?
40. So like right now we have 10 people in. That's been a fairly high number for the last several months. Usually we're around 7, 9.
With 3 people in phase 5 that will be going out here before too
Yeah, there will be 3 people graduating soon. So our numbers stay around 7 And when I'm looking at asking for, you know, over $100,000, that's probably hard to justify when we're only serving that many people. I don't know that I'm sure that's not the entire reason, because we did, up until this year, we did get funding every year for it. Our numbers have been down some. So I can't say for sure, there was a whole list of things that they submitted in the letter. And let me see if I have that, I can read it. So funding determination, funding recommendations is, they also have, there's a formula that they use for our county gets. Advisory board prioritization, so we always say salary is our priority. So that was always how we funded that. The unspent grant funds, project income balances, target populations, historical contract compliance, historical reporting compliance, alignment with evidence-based practices, number of participants served, and number of diversions from the department. So that means the number of people that could have been sent to DOC that weren't. So those are the things that they base it on when they're looking at how much we receive and if we receive anything. So there are several things that is looked at. It's not just that one thing. But I'd say contract compliance, reporting compliance, alignments with evidence-based practices. I feel like we're on top of all of that, and I've never had any issues with any of that. So there's some things that I can say that is not the reason, but for all of the other things combined.
And then I haven't heard anything where it's so waiting and they probably just due on how to go forward.
Yeah, I don't know.
I know it's coming, I just didn't know if you've heard anything.
No.
I have not.
I have not. I've reached out to, of course, the Indiana Office of Court Services. I've reached out to my program director with the state. No one has any answers at this time, which is expected. There is the, we are part of IACAC, so it's the Indiana Community Corrections Committee. And they have been meeting with the Indiana Office of Court Services as well. They are optimistic about 28, so that made me feel a little better.
The reason I brought this up, just to be completely transparent to everyone. So obviously through the budget for project income, we can continue 27. But the program is typically a 2-year program. So the reality is, do we accept more people not knowing if we're going to have a program? So that's why we need guidance and we need it now to figure out going forward what that looks like for Heritage.
Yeah, so I went through and tried to determine what is going to be coming out of our project income for 27, because it's going to be more than we've ever spent out of it, because we're now taking an entire salary and benefits to keep a case manager. If not, we would have to lose that position.
And we still people in for court. That's the issue.
Yeah, which those, we can handle.
Yeah.
I think those are okay. We can handle that until they're done. I feel like we can just keep accepting people until we know what's going to happen, because we can always run those people out. And, when we know that, okay, we can no longer do this program, we can continue with them, even if it's just, if we lose a case manager, even if it's just me, doing it, or whoever would be left could run those people out through the program. So I think that's okay. I looked at what we would be spending out of project income, and last year we spent 85,000. This year, it'll be 211, approximately 211,000. My income approximate, so I did the last 3 years, and did an average, and it was around 90,000. So
So it's a deficit.
think about that. Like, yeah, that's a deficit of over 100,000. We can do it in 27. We have the amount. We're good for 27. It'll bring our year end to approximately 390,000. But again, that's not sustainable. If we're looking at overall clients, people are paying less and less.
Yeah.
I mean, you all know how prices of everything are going up. People have to choose between paying for things or paying our fees. We try to keep on top of it, but so we're really trying to keep on top of it now. But we're looking at losing that amount in 27. So again, 27 is fine. We can cover it. We have enough PI, project income, but going forward, it's going to be that big question. How do we sustain this?
What I propose that the group does regarding this is, as soon as Tracy and I find out more, if it's agreeable to you guys, just, hold a meeting maybe outside of our every 20 days.
Yeah.
Just keep the group informed on what's happening.
What's your, I mean, maybe, I don't know if this matters, what's your success rate?
Like recidivism,
Well,
we're around the national average.
yeah, our success rate is usually around like 58 to 60%. That's the amount of people like that complete the program.
Oh, okay.
Yeah.
Perfect, okay. Once it completes the program, have you seen any reoccurrences from that still?
Sure, yeah, I mean, there is people that come back.
Relapse or whatever?
Right. When we look at recidivism, it is based on, they used to require us to do a rate. They haven't in the last couple of years because there's so many different definitions for recidivism that it varies by county, and it's hard to do statistics on that, right? So what we do is over the course of 3 years after graduation, if they've been rearrested in Perry County. Now, I can get you the statistics on that from the last time we did it, and I can't remember when that was, but
I think it's a valuable program, I'm just curious,
it wasn't high.
No, I can tell you that, like, we see less people that have gone through the drug work program come back.
I'm just saying, if we go to advocate for this funding and stuff,
Oh, yeah, I mean,
what
this is a
would we
blow.
have to,
This is a
go with?
blow, this hurts. I mean,
Yeah.
anytime you take a program out, well, Stephanie, we discussed, Perry County doesn't have a violent crime problem, we have drug problem. So does every county across the United States, right? When you take a program like this out of our community, we will feel the effects of this.
so you said it was 11 million?
Across the state, 11.2
And
million.
that was funded through, where was 11, I mean, is that part of the budget cutting through the state where that 11 million came from, I guess, that Senate Bill 1 or whatever they call it?
So I don't know the exact,
Yeah.
but yes, it was
You cut programs, I
State
think that's one of the ones I would not cut. Okay.
so. On another note, I've only ever sought out grant funding from this because this was always enough to cover us. So if it's no longer going to be available to us, I'm going to try my best to find other funding grant funding that could cover at least some of it, at least something.
This may not be possible, I don't know if there's work. Is there a partnership like with Spencer County? Since, Perry County, we're about the same size-ish, about the same rule
We talked
blocks they
about
do.
that a little bit.
Where you combine, rather than we have 10 or so going through drug court, then they have 10 or so, it's 20, then I don't know.
They have a very.
They have
theirs is-
about 40 to,
Oh.
Yeah,
they have a
are
very
ours is
big,
into the
yeah.
drug court.
Yeah.
Quite a few, okay.
They usually have a lot of people in.
Their
Now, their
funding
funding,
cut.
their funding was cut. It was actually cut by 2/3.
Wow.
So they felt it too. Yeah.
Wow, okay.
Now they got some still.
I just know if you combine your.
We have,
No, we discussed that.
Did you?
That's all I learned there.
in the past, like this was a long time ago. We combined with them to write a grant through SAMHSA. It was a big one, like $400,000 over, a year over 4 or $100,000 over 4 years. So it was 400, and we were denied that. But I didn't write the grant, so I'm not sure why we were denied. They just, that one wasn't approved when we tried to combine before. But that's definitely not a bad idea to look at again. As far as the grants go, like if we could,
I just look at our resources, Spencer County kind of a lot of same, probably have the same challenges in the
We
world.
did.
1,800, one county actually.
Absolutely.
So, I mean, go back in way history, but I'm just trying to think, what can we do?
I mean, they do it, veterans boards are known to do that. It is an option, Tracy and I talked about.
But that's more of a long term, we're here at this.
The only issue faced with that, realistically, is always transportation.
Yeah.
I mean, you're putting your
Yeah.
sidewalk in.
Yeah.
For that very issue. Transportation in our rural communities is difficult.
As a partner. I don't, yeah.
But, I mean, that's something that,
'Cause we
we're
set
gonna have
rights
to, all get creative. I mean, it's just.
Well, rights, the transportation issue, it's a right solution, I think, still have, Perry County no longer has right solution. Defunded, and so, I don't know if Spencer County does or not, but I mean, they used to get a grant that was $5,000, I think, for private transportation, pretty reasonable for
Yeah.
what was put up for to get going, maybe funding that, and that help, I don't know. It's gonna
Yeah.
be creative, I guess.
No, yeah, any idea at this point, we're gonna look at.
so with that said,
As education, there's lots to take in, I understand it all a little more, so. So you still need a motion on the
on
community
both of
corrections
them.
budget side first?
yes, we'll do that one
I'll
first.
keep my motion still standing
And
on
I'll
that.
second it now that I understand.
Didn't get trouble.
Yeah, I was like, this should be more.
Yeah.
But now I understand why the.
And then we'll need approval to approve the drug court. Thank you. Thank you. Does anybody have any other questions or anything?
Not necessarily questions, but, well, I guess. So DuBois County is like our only area that has work release. Is there any potential of being able to do that here if the jail at some point had a spot for it? And is it something that helps with their budget of being able to fund programming? Like, do they make money off of their user fees and things like that to be able to help fund?
I will tell you when I was on the new jail committee, and Dave, you were around for this too. And when we were, looking into it, the issues were, they were gonna need new jail staff. That's a whole separate training for that. And it was, whenever we ran the numbers at the time, it did not work for us. Like, it was not going to be enough money to justify, that type of program. That was also back in 2014. Like, it might be something that we look at those numbers again to see that at the time, I mean, so we cut that entire addition off.
And the reason I ask is because I know that DuBois County takes in from a lot of places and they are turning people away at this point because they don't have room.
Mm-hmm.
And so you can get people from other counties who want to come to our work release because that's an option for them. And I know previously a lot of more places had work release. A lot of places have cut work release.
They have. Mhm.
Yeah, it was money.
And so now that your work release would probably be full, not with just our people, but with other people. And I know that DuBois County charges a higher rate. or are out of county.
Right. Yeah, that's all, I mean, that's a lot of research.
Yeah, and it
You
was,
know,
and for us, it was more of a sheriff side issue
Mhm.
too.
If I may, yes, looking ahead at that, and we tried to look at that when we engineered the eastern part of the facility. So as it stands, yes, part of the pod or cell block that was made, we engineered an exterior door, an exterior hallway with another exterior door, so we would have like a Sally Port walk-through block. We had an area that we thought, okay, we could put desk, somebody there, plus lockers. But as the judge was saying, when we really started crunching numbers, and at that point in time, the load on the jail itself was just starting to inch up. And so, like you can say, back in the day when we were holding 100 people in there was just no way. And that's because we were utilizing the one general population area. And then what you said is there again, so now when you start thinking about this, you're thinking, okay, I need a minimum of 1 to 2 people who are going to be specific for that. And if they're working work release on certain jobs, and somebody might get lucky, and we're a 24/7 type workforce now, some of us, depending what kind of jobs they get. So now you're manning and staffing at least a minimum of 2 individuals for 24 hours a day, 7 days a week. And then you've got vacation, you've got your sick, you've got now more people than that because you've got to really staff it. And I'll tell y'all right now, we are down about 4 full-time individuals in the jail staff right now for jailers, and that is because the work that they're doing now for the pay and the issues they've got is we're having a turnover, and I've been to workforce, I've been to several other organizations trying to get applicants out there, and it just ain't happening.
There's a lot of that salary issue maybe in some ways, and.
I say that in several ways.
Yeah.
Springfield kills us every time we raise our salary.
State police is good. State police is good. They're gonna study on that. I love them.
And-
Stephanie.
And
They're not raising mine.
I know it used to be a kind of a joke in a way, but not to malign them, but when you've got McDonald's advertising what they will pay.
Yeah.
And again, and I'm not trying to cut anybody in any job that we all do, right? And we all think we've got tough jobs. But if I had a job, like somebody told me this exactly, said, it's mindless work sometimes to sit there and flip hamburgers, but guess what? I can do that and cook them and move on, and when I go off and walk out the door. I don't have anything to do with this anymore. And all of us here are in these jobs where you can't shut it off and walk out the door, and it's not a mindless, repetitive work that we're doing anyway because we're always interacting with individual people. And it's tough. And so, yeah, that issue of that type of work has got a lot of people when they come into it and go after a while, it's like, this isn't for me. Can't do it. Don't want to do it. So this is difficult. Then yes, I'm agreeing with the judge right now, at least right now, until the county could sit there and say, yes, we're going to fund a minimum of X number of extra people. And the workload that that's going to entice, then maybe we don't want to be able to revisit work relations issues.
And they've got their own, just like the state does, their own budget reduction, the state, that's going on, all the effects from that. I mean, it's a challenge.
Right now, the last thought on that is that the setup, and we've always tried to do this when we built it, and when I say we all built it. And I'm seeing this again, it seems like we cycle somewhat in the criminal activity we get involved in. So even though we've got a very good sized facility and the numbers are low, thank you for that, and the prosecutor too, that we're trying to keep those numbers down. We still wind up with issues in this new age we're in, how to separate individuals in that confinement area because of the crimes they've committed and even retaliation and other things from even other offenders and inmates. The mental health issues. I've had one person who's been segregated for over 60 days. They're refusing to take their meds. I think they do better if they would take their meds, but I can't force that on them. So yes, even though we got this facility and the numbers are down, this inner movement that we have of people is taxing and how to deal with it. If I may, just one last thing. I'm sorry, Mayor, but I've heard this before, and I've known Tracy in this program for a lot of years, and the judge. Always in the past, I thought when they talked about how many people do you have that graduate, or and they talk about recidivism, some people in the public are quick to jump on that. There is a deal where people will falter, whether it's their drug use, alcohol use, their work ethics, or something else. And over a lot of years of kind of watching this is that don't just track and talk about a small number like it's insignificant. Because I'm telling you now, if you just had 3 persons, let's just take a small number, 3 persons that get through the program, get a job, and actually are producing out here, drawing a paycheck, suddenly for the rest of us, we don't really realize that the rest of society is that person now is drawing a salary and paying taxes. That person now is usually buying some things with their money. And that person now is also paying some of that child support they used to have to pay that they skated on. And so it actually trickles and moves out. And so when you're thinking of $100,000 as a number and you're extrapolating that, 3 people will pay that back in spades within a year.
Well, I think one story is a success. You know, we want everybody to be productive, good, law-abiding community citizens and productive. So even one, I was just curious if what those numbers
Right.
look like. I never have really thought about it that much.
But some will look at it and they'll go, well, it's such a low number. And I'm like, no, you gotta think what that number's producing.
Yeah.
So kudos.
I didn't know.
Thank you.
And I was asking this alcohol. I figured it did, but I got into the question. I didn't want to ask it. But yeah, it's good. Great. Yeah. I've known several people that's been through that program for that, even especially that's went on to do great things. So it's a shame we didn't get the grant funding. I hope to God 28. I don't know who to talk to yet, but we'll maybe.
Right.
We'll
I'm
figure it out.
staying positive. It will be better. And again, if we can't rely on this funding, I will do my best to search out other funding that we can keep it going. So,
Are you familiar with the Good Samaritan? I think it's Good Samaritan, sound right? Is that it? Being for Others, sorry, Being for Others. I don't know if that's what funded this or not. We had a big grant thing. I've got a pamphlet on that I can try to send you, but I don't remember if that was on there or not, but mental health.
yeah, you can
Okay.
send it to me. I'll take a
think
look
about it.
at
I've
it.
got one on mental health I just thought of too, but it's not, it's only a short-term solution. It's
Yeah.
only one.
On a good note,
Yes.
well, I guess say it again.
Yeah.
We had, so we have CTP. So CTP is Community Transition Program. That brings people out of the Department of Corrections, usually like 3 months to 6 months early, okay? The state, so the Department of Corrections then pays us each day to have those people. We typically don't accept a lot of CTP people, and we haven't in a while. For reasons that most of the time, they get a lot of time cuts, right? Like when they're in DOC. And so it's like you send them there and then, 2 months later, you're getting this CTP eligibility that they're already ready when they just got there. So a lot of the times we don't accept them. With that being said, we can maybe open up that idea a little bit more and start accepting more people again, funding wise. It'll bring in some money. We did have we have a fund, the CTP fund that we've had since before I was here. And it has about $44,000 in it. That fund, I got confirmation from Bruce, the program director. That fund can be moved into our project income to help cover that loss. So that is a good note. So 44,000 is a good, but then, I mean, we're gonna drain that fund completely down, but that's okay.
Yes.
Because it's not used for anything except for community corrections programs. So,
And this is why I love Tracy, another reason, like, she is always that rainy day fund person. Like, she's got this money that I'm like, what's this? And she's like, well, let's keep that.
yeah.
And it happened.
Yeah.
And so I'm very grateful that you think ahead as far as you do.
It's okay. You come on in.
Other question about funding. What about getting some of the opiate settlement fund?
That was a question mark on my list also to possibly look at that. I don't know. I don't know the answer to that, but it's something that we can definitely look at questioning or asking about.
Almost positive, almost positive not all of it's been used. So I think if you're talking about the things that would go to help move your forward.
Right.
Your court
Yes. Yeah.
sounds like the best one that you could possibly do.
Yeah. Because it's directly related to drugs in the community. So, yeah. Yeah, that's definitely something that we can look into. I'd have to, go about seeing how to go about that. But yeah, we can talk about that. Okay. And then we have another little bit of a savings, I guess we'll call it. Our field officer, my current field officer, this is his last year. So for 27, I didn't remove it from the budget because I don't want to not have that available for him, for a field officer, even in the future. So I didn't want to remove it because I didn't want it to look like we don't need it. But he will not be working in 2027. So at this time, I don't plan to rehire that position in 27. We'll look and see what 28 looks like before we make a decision on whether we'll refill that position. I think that's the smartest thing to do. Even if it's not very much, it's like 15,000, but that's still 15,000 that we won't be spending out next year. So we're gonna keep that position in the budget, in the grant, because it is needed. It's just with our cuts for 27, I'm not gonna, unless something happens where he wants to stay on or whatever, then the money is there, so. All right, does anybody have any other questions or?
No, I just want to again thank you, Tracy, for everything that you did for this. I know that, to give you guys a background, Tracy brought drug court to our community. Like, she's been with it from day one. They know that this was devastating to her. And I promise that I will use every tool in this toolbox to help you with this program. I think it's valuable to our community. And I know I've seen the impact. So, but again, thank you for all that you've done, Karen, you as well.
Thank you. We're gonna stay positive and
Yep.
a 28 is gonna be better. That's my outlook right now, so I don't get too overwhelmed with it.
And then I'm in the background, forget it.
I'm like, she's like, you wanna have a meeting with me? I'm like, no. No, we're good. We'll wait till we have more information. So,
All right.
anybody, so the only other thing on the agenda is obviously every time we meet, I have to report our numbers. All the other programs are doing well. And then the next meeting is scheduled for September 1st, just to stay on track with what way we had it. I know I moved this one back, but that was because of this budget information. So we'll stay on track and do September 1st for our next meeting. at 3:00. I need a motion to adjourn.
I move to adjourn.
Second.
Second.
Thank you. All right. I'm gonna end the, whoops, in the wrong one. I'm gonna end the live now. Figure it out.